Today, our speech impediment is orofacial myofunctional disorder. What is orofacial myofunctional disorder? This is a disorder of the muscles and functions of the face and the mouth. This may affect directly and or indirectly breastfeeding, facial skeletal growth and development, chewing, swallowing, speech, occlusion, temporal mandibular joint movement, oral hygiene, stability of orthodontic treatment, and facial aesthetics.
Some causes of OMD are restricted naval airway, improper oral habits such as thumb or finger sucking, cheek, nail, cuticle biting, and teeth like grinding, clenching. Some another cause is when babies and toddlers suck on their thumbs or use sippy cups.
I'm sorry, they're so loud back there. What are the symptoms? Someone who always breathes through the mouth or has difficulty breathing through the nose, limited tongue movement, eating may be messy or difficult, an overbite, underbite, and or other dental problems, the tongue pushing past the teeth even when a person is not talking or using the tongue, difficulty saying some sounds like S in sun, sh in ship, or J in jump, drooling, especially beyond age 2, and difficulty closing the lip to swallow.
How does this impact a person's speech ability? If speech sound errors exist, they typically involve the sounds that require tongue lip evaluation and alveolar.
Alveolar.
Pelate. Rigid precision with this tongue sticks out between or presses against the teeth, causing a distorted production of the T's, D's, N's, and sounds in frontal layered or jaw what does that say? Protrusional lisp for the sounds of Z's, sh, or sh, t's, or J's.
What are your therapy options? Therapy will depend on the result of the evaluation and will likely target several aspects of OMD. Various exercises will be used to prepare patterns of muscle movement for articulation and or swallowing. The speech-language pathologist may also work on eliminating any negative behaviors that contribute to OMD, like thumb sucking. If you have this disease, you can really start therapy at any age, as it's quite easy to overcome.
What would this be like? Having this disease would be very difficult sometimes because most people nowadays are really insecure about stuff. They often hide their problems, such as stuttering, to seem normal. People who also stutter from this disease eat very loudly and have bad oral hygiene. And their jaw looks a little bit different from others. And all of these things may people.
You're lying. Okay, it's still going.
Sorry, it said 10%. So, when you have this, you should go to therapy once a week for 16 weeks.
So I'm going to read the testimony to you. The burden of strained relationship with friends, family, and colleagues due to behaviors I used to hide my stuttering had been a hindrance in advancing my life and career. Recently, a job promotion that I had been working towards for several years now was offered to me. It is clear that the patterns of my behavior I used to hide my stuttering were major reasons the promotion did not happen to me earlier. Laura's wisdom and skill have led me to improvements in my behavior that allowed my coworkers to have a new confidence in my abilities. There are very few people that have a combination of the confidence, compassion, and ability to change lives. The SLP world is fortunate to have such a professional in Laura Smith. This was an adult male who has OMD who got therapy from a therapist. This is like the king's speech because like this man, the king was embarrassed by his speech impediment and felt like he let his whole family down, especially since he was very well known as he was the king's son and obviously a future king. And they also both worked very hard to overcome this hurdle in life by going to therapy and never giving up.
As you can see, living with OMD is kind of stressful. I personally wouldn't want to have this. I probably would be embarrassed. So hopefully you learn something about OMD and not to make fun of people for their speech impediment.
Something that they can't help. Don't make fun of people for something they can't help at all.
Exactly.
So yeah.
Bye, Miss Coach. I hope you're having.
Bree wants to say.
Bree, come here. We're done.
She's coming.
Bree wants to say hi. Hope you're.
We miss you.
Yeah. Hope your son's doing good.
We're really bored. Say goodbye.
We're done.
Miss Kojak, they would not let me in on this. I was trying to record.
I was okay. The camera. Okay. I was laughing because I can hear her through the other room, Miss Kojak.
But when
You
she
could
was
not.
filming
Yes,
us, we would not stop laughing.
Autumn, come here.
She's working.
Let me show her. Miss Kojak, I'm not even using my crutches. Oh my god. Hi, Miss Kojak.
Bye, Miss Coach.